Hey everyone, welcome back, or if you're just joining us, welcome to KSSP Podcast. I'm Spencer.
I'm Katie. Today we're going to be discussing benzodiazepines in this episode. So, first we're going to look at this image from Cornerstone of Recovery. It basically just shows, so normally we've got enzymes and neurotransmitters, receptors, etc. We got the axon and the dendrite and all that. But then with benzodiazepines, they bind to receptors to inhibit neurotransmitter release from the axon here. And the typical routes of administration, mainly oral, usually you just take the pill, or some people can snort it too, but that's not as common.
And then we'll go into the pharmacology of benzodiazepines. So, benzodiazepines increase effectiveness of the endogenous chemical GABA to decrease the excitability of neurons. It reduces communication between neurons and can have a calming effect, or leading to its calming effect. GABA controls the excitability of neurons. GABA receptor is a protein complex located in the synapses between neurons. GABA receptors have two binding sites for the neurotransmitter gamma-aminobutyric acid, or GABA. A subset of GABA receptor complexes also contain a single binding site for benzodiazepines. Binding of benzodiazepines to this receptor complex does not alter the binding of GABA. Benzodiazepine binding acts as a positive allosteric modulator, increasing the total conduction of chloride ions across the neuronal cell membrane. When GABA is already bound to its receptor, hyperpolarizes the neuron's membrane potential. There's a difference between resting potential and threshold potential, which is increased, leading to firing being less likely. Activation of different GABA receptor subtypes by benzodiazepines may result in distinct pharmacological actions. Referred to as benzodiazepine receptors is what those are. And then GABA receptors that are made up of different combinations of subunit subtypes have different properties, different distributions in the brain, and different activities relative to pharmacological and clinical effects. Benzodiazepine ligand locks the benzodiazepine receptor into a conformation in which it has greater affinity for the GABA neurotransmitter. This increases the frequency of the opening of the associated chloride ion channel and hyperpolarizes the membrane of the associated neuron. There's an inhibitory effect of the available GABA is potentiated, leading to sedative and anxiolytic effects. The benzodiazepine class of drugs also interacts with peripheral benzodiazepine receptors. These can modulate the immune system and are involved in the body's response to injury, and also function as weak adenosine reuptake inhibitors. Peripheral binding sites for benzodiazepines are present in immune cells and the gastrointestinal tract.
Alright, so next we've got the side effects of benzodiazepines. The most common ones are drowsiness, lightheadedness, confusion, unsteadiness, especially in older people who may fall and experience injuries. Then we have dizziness and slurred speech, muscle weakness, memory problems, constipation, nausea, feeling sick, dry mouth, or blurred vision. And then there's some less common side effects that include headaches, low blood pressure, increased saliva production, digestive disturbances, rashes, sight problems such as double vision, tremors or shaking, changes in sexual desire, incontinence, loss of bladder control, and difficulty urinating. So, there's also some paradoxical effects, and these are side effects which are the opposite of what the medication is supposed to do. So for benzodiazepine, they include aggressive behavior, agitation, anxiety, delusions, or strongly held beliefs that other people don't share. There's depersonalization, feeling detached from your surroundings. Then depression, derealization, or feeling out of touch with reality. Hallucinations, inappropriate behavior with loss of normal inhibitions. Irritability, nightmares, personality changes, psychosis, rages, restlessness, and suicidal thoughts or behavior. And then these effects may happen with any benzodiazepine, but they're a lot more common in children and older people and with short acting benzodiazepines. So that was our episode on benzodiazepines. And join us in the next one as we talk about crack and cocaine.
And as always, you can leave a comment below if you have any topic ideas you want us to go over in future episodes.
And you can reach out to us on Facebook, YouTube, Instagram, Twitter, TikTok. We also occasionally Twitch live stream, so follow us there to join us and be notified when we do.
And don't forget to give this video a like, as well as follow or subscribe to our other social media accounts and turn on notifications so that you get notified when our new content comes out. Otherwise, we will see everyone in the next video.